scanning technique for partial edentulous arches is the same for both RPDs and immediate dentures. If your scanner has AI mode, turn it off before scanning. Begin scanning on the teeth, then slowly transition to the edentulous areas. Do not move too fast at the edentulous area. Stay on attached gingiva as much as possible. If tracking is lost, return to the teeth and restart scanning from that area. Commercially available intraoral scanning sprays may be used when scanning is difficult. After completing the scan, carefully inspect the scan to confirm that all tooth surfaces has been fully captured, especially the mesial and the distal surface adjacent to the edentulous spaces where voids are common. If any holes or distortions are present, return to those areas and rescan. There are some common problems when you scan partial edentulous arches. First, stitching errors in edentulous areas. When edentulous areas lack sufficient keratinized tissue, scanner software may have difficulty stitching images accurately. This can lead to positional error of the teeth in the digital model. In severe cases, obvious errors may occur. For example, posterior teeth may appear crossbite due to inadequate keratinized tissue. This area only has one missing tooth. The risk of the error increases as the length of the edentulous span increases. Minor inaccuracy, half to 1 mm, are much more common and often go unnoticed. These errors can result in excessive chairside adjustment, or you may have to let the lab to do the remake, particularly for RPD with metal frameworks. Another problem of intraoral scanning is it cannot reliably capture functioning border of soft tissue. When fabricating, RPDs rely heavily on soft tissue support. Impressions with border moldings are required. In such cases, intraoral scan alone is not enough. Depending on whether the patient has existing RPD or not, follow either intraoral scan plus impression with existing RPD workflow or intraoral scan plus impression with Easdent tray workflow. There are different ways to improve the accuracy of digital models. Stitching errors occur more frequently in mandibular arches due to limited keratinized tissue. You may have to use these strategies more frequently for mandibular arches. If the patient has existing RPD with short edentulous ridge and the RPD is stable in the mouth, perform additional intraoral scan with RPD seated intraorally. Scanning through the rigid RPD can minimize the stitching errors and can improve the tooth position accuracy. The lab can combine the scan with and without the RPD to verify and correct minor tooth position errors. Hybrid digital models use accurate tooth position from the scan with RPD and the detailed tooth and tissue anatomy from the scan without the RPD. Although minor inaccuracy may remain in soft tissue contour, accurate tooth position is far more important, especially for metal framework fabrication. Soft tissue is compressible, and small contour discrepancy generally do not affect RPD seating or cause sore spot. In contrast, teeth are rigid. Even minor errors in tooth position can prevent proper framework seating and may result in excessive chairside adjustment or even a remake. When the patient has a long edentulous ridge and the RPD is not stable in the mouth, or the patient cannot get a stable bite with the existing RPD, the RPD can be used as an impression carrier. Follow the intraoral scan plus impression with existing RPD workflow. The impression can help increase the accuracy of the digital model. If the patient does not have an existing RPD and only have a short span edentulous ridge, 1 or 2 missing teeth, place a wax bowl in the edentulous area. Make sure the wax bowl is stable in the area. Scan the arch as if scanning with an existing RPD. Wax provide a rigid scanning surface and reduce the stitching errors. The The lab can create a hybrid digital model similar to scans taken with an existing RPD. When the patient has no RPD and long edentulous ridges, use Easdent tray to get impression to help increase the accuracy. You can follow the intraoral scan plus impression with Easdent tray workflow. When accurate digital models are obtained, digitally fabricated partial dentures should require minimal to no chairside adjustment.